Okay. So before I enter a patient's room, as I walk in, I'll make sure to knock on the door, and I'm doing hand hygiene, and then I would introduce myself. So, hi, my name is Grace. I'll be your student nurse today. Can you tell me your name and date of birth?
Travis, 11299.
Okay, and I'll just check that against your wristband, and that all matches up, which is good. And then, is it okay if I do a bedside assessment on you today?
Yes.
Yes? Okay, great. So I would start by just asking a couple questions. Do you know where you are right now?
Yes, Saco.
Saco. And do you know what day it is?
Monday.
Monday. Great. So judging by those questions, I could say that the patient is alert and oriented ×3 to person, place, and time. And then next, I'm going to look at your pupils. So just focus on me, and I'm going to be coming in from the side with your light. Perfect. Yep, and then now just focus on the light, and I'm going to come in towards your face. Perfect. Okay. So judging by that test, I would say that his pupils are equal, round, and reactive and accommodating to light, which is great. And also, judging by how he's been speaking to me throughout the assessment so far, I could say that his behavior and verbalizations are clear and appropriate. And yeah, so his neurological assessment would check out. So next, I'll move on to his cardiac assessment, and I will start by auscultating on his aortic space on the second intercostal space on the right side of his sternum. And in this video, I'm just going to do it over his clothing, but normally in a clinical setting, I would make sure to do it right against his skin. So as I said, I'm going to start on his second intercostal space in the aortic. And then I'll move over to the left for pulmonic. And down to the third intercostal space on the left for Erb's point. And down to the fourth for tricuspid. And then over to the fifth intercostal space on the mid-clavicular line for the mitral. Perfect, and after listening to those heart sounds, I can say that S1 and S2 are clearly noted and beating at a regular rhythm. So next, I'm going to check his capillary refill. Can I just have any finger? Perfect. And it is about 2 seconds, which is great. And then next, I'm going to check your peripheral pulses. I'm going to start with your radial pulses. And I'm just going to feel both of them at the same time to make sure that they're even in strength. Yep, they're both at 2+. And then now I'm going to go down to his feet, and on the top is his dorsalis pedis pulse. So those are even, and then on the inside of his ankle for his posterior tibialis pulse. Perfect. And then while I'm down here, I'm also just going to assess for any edema on his legs. I'll lift this up. Good. Good. And then I'm going to move on to his respiratory assessment. Have you noticed any cough or sputum recently?
No.
No? Okay, so I'm going to start then by listening to his lung sounds, and I'm going to do a few on his anterior side and his posterior, and I'm going to make sure to listen to his right middle lobe on his anterior side. So each time you feel my stethoscope hit your chest, can you just take a deep breath for me? Great. So I'm going to start at the apices of the lungs. Deep breath. Yep. Okay, perfect. And then can I just have you scooch forward? And on the back, I'm going to start at the top, and I'm going to make sure not to listen over the scapula. turn them over to their sides. And last deep breath. Perfect. And judging by that, I can say that his breath sounds are clear and unlabored, and also even. So next, I'm gonna move on to your GI system. Has your diet been regular lately?
Yes.
Have you been tolerating your diet just fine?
Yes.
And when was your last bowel movement?
This morning.
This morning? Is that regular for you?
Yeah.
Is there any pain with that? No? Okay, good. Now I'm going to inspect his abdomen, and I'm going to start by just inspecting it before I auscultate or palpate. So do you mind if I lift up your shirt for you?
Sure.
Okay, great. So just looking at his abdomen, I can see that it is non-distended. So next I will auscultate all 4 quadrants of his abdomen. Perfect. And I heard normal active bowel sounds in all 4 quadrants. So next I'm going to palpate his abdomen. I'm going to start with just soft palpations. And can you notify me if you feel any pain or tenderness?
Yeah.
Thank you. Any pain or tenderness? No? Okay, so then I will go a little bit deeper. Any pain? Perfect. So, judging by that, I can say that his abdomen is non-distended, soft, and no tenderness. So next I will move on to your GU system. Have you been urinating regularly?
Yes.
Yes. Do you feel any pain or burning sensation when you pee?
No.
No. And can you tell me the color?
Yellow.
Yellow? Okay, perfect. And then, is it clear or cloudy?
Clear.
Clear? Okay, great. And next I'm going to judge your musculoskeletal. Can you sit up for me? Okay, great. And then can you raise your arms up and above your head and back down? Good. And then can you squeeze my fingers? And I'm going to ask him to do them at the same time to judge equalness and strength. Good. Good strength. And then I'm going to have you do your hands like this and push against my hands, resist my hands. Great. And then I'm going to put my hands on your knees, and can you lift up against my hands? Great. And then that is good. I'll move on to his integumentary system, and I can have seen already through this assessment that his skin is warm, dry, and intact. And do you have any wounds or dressings
No.
at the moment? No? Okay. And then I'm also going to assess his skin turgor. Perfect. And judging by that, it went right back. So I would say that his skin turgor is good. And that would conclude my assessment. So before I leave, I will ask the patient to lay back down in bed and make sure that he's in good position. Yep, and I'll make sure that the bed is in the lowest position and that he has his call bell right next to him. And then before I leave, I'm going to ask him if do you need anything?
No.
No? Okay, great. So I will be right around if you need anything. Just press that call bell.